Guys, I have some really bad news. We are seeing an influx of patients coming in having a second ACL surgery. Part of the reason we're seeing so many retears of ACL surgeries is because first rehab that a patient got wasn't the most appropriate for what they're getting back into doing. People sometimes are in a geriatric setting, but we need to do sports training. Or maybe sometimes because the rehab is only being shortened to 1 or 2 days a week, and it should be more like 3 or 4 times a week. We are geared towards sports, and we know exactly what you need to get back to playing your sport efficiently after surgery. So let me paint the picture for you. A student athlete gets injured, they have an ACL tear, and they decide they're going to go forward with surgery. Once they have that surgery, insurance usually only covers about 3 to 4 months of care. We know that is not enough time to get a patient back to the level of activity they were playing before. Most orthopedic surgeons' protocols for post-surgical are 12 months. We're only getting a quarter of that based on insurance. Some patients decide to pay out of pocket to continue their rehab, but some unfortunately don't, and they decide that they're going to piece their rehab back together with their own at-home exercise program. The problem with this is they never get back to the cutting and agility work that we know is necessary to stabilize that knee. So now, fast forward a year, the athlete's back in their sport, but not fully strong, and they tear their ACL again. Take it from me. This happened to me before because I had ACL surgery 20 years ago. The thing is, insurance back then covered a full year's worth of rehab. Now, again, it's only 3 months. There's no way that we can make up for that because of insurance companies and what they're deciding to do. We have come up with a concierge level of PT rehab post ACL surgeries. What this looks like is a full year of care. You're going to get all the care that you need, starting from once you're coming in after surgery, when you're on crutches, and we're dealing with the swelling and the pain and the incision. We're going to work on your range of motion and making sure that you have full range of motion before we start progressing all the strengthening that we need. Your strengthening is going to look like squats and using our Pilates reformer and our red cord suspension therapy to make sure that you have the foundational strength that you need even before we get you up on the floor. We want to make sure that you are strong enough to be able to do everything we need to do to get you back to the sport. We'll also incorporate, when the time is right, agility work and deceleration and plyometrics to make sure that you're able to cut and do those sport-specific training before we get you back on the field. We will also incorporate recovery. Once you're back on the field and sprinting and playing, we know that there's a cardio lack because you haven't done anything for 6 months. Coming with that is going to be sore muscles, and we need to do the recovery as well. The concierge level of care that we're looking to give to you is something not based on insurance, but based on the quality of your recovery. You know what high level of activity you need to be back at, and we're going to match you every step of the way.